Hey guys, Kari Butena, welcome back here. My name is Maddie if you guys are new here to my channel, and most of my content is to help nursing students, nurses, and other healthcare workers. In today's video, I'm going to be talking to you guys about what to expect for your first semester of nursing school and some of the things that I went through and want to share with you all so that you're better prepared and kind of know what to expect. So without further ado, let's talk about what to expect your first semester. So whether you've already been accepted to a program or are trying to get accepted or are just thinking about nursing school in general and maybe you haven't even applied yet, you might be wondering, what is your first semester going to look like? And specifically, what kind of classes am I going to take? So I want to talk to you guys first about what type of classes you might be taking your first semester. So some of the classes you might take may include pharmacology, which is where you learn about the different drug types, how they act on the body, and what you need to teach patients with regards to them. You might learn pathophysiology, which is different diseases and how they affect the body. You might be taking what's called fundamentals or foundations of nursing, and this is usually the very first nursing class that you take, where you talk about kind of everything as a whole, from drugs to diseases to caring. And a lot of nursing school classes, the med-surg and fundamentals, will talk about specifically how the nurse is supposed to teach and care for patients before, during, and after procedures, or before, during, and after a disease process. So foundations or fundamentals of nursing goes over the very basics, the foundations of nursing, of course. And you might expect in this class to learn things such as basic vital signs, what to look for, what's normal, what's abnormal, and how to treat it. You'll learn things like diet. A lot of the questions may be worded, a patient needs to have more fiber in their diet or more protein. Which of these food choices would you pick, and things like that. Foundations classes also cover a lot of new terminology, that other like medical jargon that we use on a daily basis and have to interpret anyways for our patients. You'll be learning that. You'll learn how to make care plans for your patients. You'll probably learn things like AIDIT, and a lot of times your foundations goes along with your first clinical. So you kind of talk about the skills you'll be learning, like hand washing, infectious disease prevention, AIDIT, which is like how you introduce yourself to a patient, nursing code of ethics and stuff like that. Just think your very basics of learning in nursing. But then your clinical class, you'll usually have a skills portion to that class where you learn skills such as basic things like hand washing, maybe how to give PO medications, how to drop medications in a syringe, inserting a Foley catheter, inserting a NG tube, which is a nasogastric tube, goes in the nose or the mouth, and it helps decompress the stomach of air or bad contents that are in there. So you'll learn how to do all those skills first, and then once everybody's completed them, then you move on to your first clinical, and that's where you're just going to take a patient with a nurse or a preceptor. We're doing a lot of observation, talking to the patient, figuring out how to make a care plan for them. We all love care plans, see me rolling my eyes. And also practicing those very basic skills little by little. Another thing you might take in your first semester of nursing school would be health assessment. And health assessment, once again, kind of ties into your skills. It goes over the nursing assessment, but in much depth. So doing an eye exam, using the Snell and eye charts to determine vision, determining like color blindness, potentially doing like hearing tests, doing the Weber or Rhines test where you use like a tuning fork, having people practice walking, checking gait and balance, listening, to your lungs, your heart, all that basic good assessment stuff. But it will be very in-depth compared to what you'll probably do on the actual clinical floor, because they want to make sure that you know details in case you have to do a detailed assessment, what we call a focused assessment, as opposed to just a head to toe. So hopefully all that's making sense so far, and that's hopefully a good overall summary of what kind of classes to look out for and you may be taking. Another thing to expect for your first semester of nursing school is however you're studying now, you're probably going to have to throw that out the window. And I'm not joking either. A lot of your prerequisite classes like anatomy, chemistry, microbiology, all those things, you do a lot of studying for and memorization. You memorize equations, you memorize terms, you memorize body parts, lots and lots of just memorizing flashcards and things like that. Well, you're not going to be able to apply that to the way you learn in nursing. It may work for pharmacology when you're learning all those drugs. It may work for certain diseases, but when you're talking about the disease process and teaching and nursing as a whole, we can't do that. It's more critical thinking. You have to think in terms of like a case study. Here's a patient, here's their situation, here's what they're complaining of. What do you want to know? What do you want to do? What do you want to teach the patient? What should you assess for further? And that's not stuff you can just memorize. You have to think through it like a logical problem. So just make sure that when you're doing that, I have lots of videos on how to study for nursing school. And there are a lot of videos on how to study out there, but definitely think of in terms of you're going to have to be educating. So when you study as though you're getting ready to turn around and teach it back, and do that with your peers. And that was the best way I learned to study in nursing school. If you're studying by memorizing flashcards, or you think that 30 minutes to an hour of studying one topic is going to be enough, that's not going to cut it, and you're going to have to change your studying habits. Another thing to expect is having certain things that you'll have to take to clinical days or test taking days. And this would be your uniform, your shoes, your stethoscope. You will have almost like the student handbook type thing, or a lab handbook, and that's going to tell you what you need to take into your clinical days with you and on your test days with you. So I would take that and I would write down on a piece of paper all the things that you need before you walk out the door, and then actually tape it to your door so that anytime you're getting ready to leave at 6 a.m. in the morning to go to your clinical day, you see that sheet and you can say, oh, I need to take my badge, or oh, I left my stethoscope in my closet, I need that today. And you have that list there. So make sure you pay close attention to that. Just because somebody's wearing their hair down at clinical and seems to be getting away with it doesn't necessarily mean that you'll get away with it too. Another thing to expect is that not every instructor or professor is going to be the same. They're going to be sticklers, and they're going to be people who are super lax. But until you know who those people are, just follow to the T. Kind of along the same lines of knowing what you need to take to clinical, create a clinical bag. And I also have videos on what I took to clinicals with me. But figure out what you will need on those days and have a bag that's pretty much always packed with that stuff, that has a clipboard, snacks in it, all that good stuff. And make sure you always have a bag ready for leaving the house to go to clinical with, because it'll just make your life a lot easier. Another thing to expect during your first semester of nursing school is that you are going to be very busy, because you are relearning how to study, you're learning how to take nursing school exams, and you're learning how to manage your time schedule. So a thing I would recommend is keeping your extracurriculars at kind of a minimum. I realize some people have to work in school. I had to work during school. If you can, try to work just part-time or PRN as needed. Try not to play sports or, get involved in your school's play and stuff like that. At least until you understand what nursing school is going to be like for you. It might be really easy for some people, and it might be really, really difficult for others. And you just don't know which one you're going to be. Try to keep your extracurriculars at a minimum so that way you can focus. And then afterwards, if you're like, hey, this wasn't as bad, start adding things back in. You'll have tested the waters and know what you can handle. All right, another big thing that I'm probably going to harp on here for just a moment is if you have never been a CNA, a certified nursing assistant, if you've never worked in a hospital or volunteered, it is going to be a shock to you most likely on your first couple of clinical days. And I just want you to say these affirmations to yourself right now, and that is, I am brand new. It is going to be overwhelming. It's supposed to be overwhelming if you've never been exposed to it before. But I am a sponge. I want you to say that to yourself. I am a sponge, because you are just going to be there to soak in everything, soak in what you see, soak in talking to your patients, soak in what the nurses and the instructors are telling you. Watch the CNAs and see what they're doing and try to follow their pattern until you kind of know what you're doing. It's your first semester. It's the first time you're starting. But with that information, do your best. Do your best to be helpful. Do your best to answer call lights. Do your best to follow the CNAs and help them, not just the nurses, and realize you guys aren't CNAs. But if you help the CNAs, they will kind of be your little best friends, and you will get comfortable more quickly doing very basic patient care, and then you can kind of step more into the actual nursing skills and stuff like that. Just be prepared and tell yourself, I am a sponge. Okay, one other thing that you guys really should know, and I've already kind of touched on it, is not every professor is going to be the same. You're not going to be able to argue scores, test scores, and questions with professors. Be aware of that, but also be aware that some of them are going to be sticklers, some of them are going to be laid back, some of them are going to be helpful, and some of them are going to be really rude in the classroom. Some of them are not going to be good lecturers, and some of them are going to be pros at lecturing. So just get ready and know that, because you may need extra material to study. So start kind of gathering some resources now, or talk to students who are ahead of you who kind of figured out how to study. If the professor doesn't lecture very well, if the instructor's kind of a stickler, talk to somebody who's kind of already gone through it within the same program. But just keep in mind, not everybody's going to be the same, and that's not your fault. But also realize that you're not going to get them to change. So if they're not teaching material in the way that you learn best, you are going to have to be the one to learn how to study the way that suits you best, and find those extracurricular means of studying and learning, whether it's online, whether it's a YouTube video, whether it's another textbook, whatever helps you. Just be ready to start seeking those out if you're not grasping the material and the professor is not super helpful. All right, and then last but not least, and you guys have probably heard it, if not from me, then other people, especially upperclassmen, and that is, don't try to be a straight A student. Just pass the class. And I know that sounds terrible to say, just pass the class. Obviously, give it your best effort, but if you're not making A's and you're not being a perfectionist, I'm sorry. But make your focus learning, so that way when you graduate, you're not having to relearn everything. Don't learn it just for the test. Learn it to actually learn it. Learn it as though you're getting ready to actually go in and save a life or teach a patient. And you will do as well as you need to do. But don't get so caught up in trying to make straight A's. All right, guys, that's all I have for you. I hope that all of this information was helpful. A lot of it is based on my own experience. And if you guys like content like this and want to see more, please hit the like button and subscribe to my channel so I can keep making these videos. And if you have comments or suggestions on what was helpful or what you want to see more of, leave me a comment down below so that I can read them and respond to them, and make content that's helpful for you guys. So thanks for sticking around and watching, and I will see you guys later. Tutu and Anna.